Okay guys, we're going to be demonstrating techniques to measure a chest excursion. So we went over symmetry, which gives a rough estimate. It's pretty subjective. If we want to have some objective or quantifiable measures of chest wall expansion, maybe we think that's contributing to their inability to exercise, we can measure it using a measuring tape here, right? So we have Joe here who's been serving as our model. The most reliable position to measure chest wall expansion is going to be the xiphoid process. That's pretty consistent landmark for most people. That you could also measure it at different parts along the chest. That's completely fine. The most reliable and the one we're going to demonstrate is going to be the xiphoid process. Now, I have a spring-loaded tape measure right here. You can also use just one of the roll-up ones. That's completely fine. There's also two different approaches to measurement. One is you can measure it kind of dynamically, which can get a little bit tricky, or you can just measure it if the patient's comfortable doing this with them fully expired, measured, hold for a second, fully inspired, measure, hold for a second. So you're going to be measuring it, both full inspiration, full expiration with the patient holding. Now, some patients may get a little lightheaded doing that. Joe, you gonna be okay if we have you do that? Hold your breath a little bit. Okay. Again, just always ask the patient if they're comfortable. So we're gonna be measuring again at your chest wall here. Joe, kind of at the bottom part of your rib cage. Is that okay? All right, great. So I'm gonna measure here. For me. If you could you grab that other edge there for me? Thank you. Great. So we have our measurement placed here. All right. And Joe, can you take a deep breath out for me? Breathe all the air out of your mouth. Okay, that's about 32. And take a deep breath in. Good breath. Good. And hold. And breathe out again. Good. And that is chest wall expansion. Again, you can do it a couple different ways. That's more the dynamic approach. You can remeasure it after each phase. That's all fine. But again, biggest thing is measuring it at the xiphoid process, full inspiration and full expiration to see the change in distance as they breathe.